The country is headed for yet another week of paralysis in the public health facilities across various counties, with nurses under the Ministry of Health also expected to down their tools.
And as Stephen Letoo reports, the Controller of Budget report has shown that despite the strike, counties are allocating most of their resources to the health docket.
Another week, another set of chaotic scenes in hospitals as 5 counties join in downing their tools to protest the failure by county governments to implement their return to work formula signed last year. Counties to join the strike include Kwale, Garissa, Samburu, Kirinyaga and Embu are also expected to join. According to the Kenya National Union of Nurses, the members under the Ministry of Health will also down their tools, with Kenyatta National Hospital as well as the Moi Teaching and Referral Hospital adding to the list of facilities that will lack the essential workforce. But according to the Control of Budget report, counties have been allocating the highest amount of money to the health docket, and paying the extra allowances will require adjustments to other payments. Nairobi City County allocated the highest amount of money to the health docket, with Governor Mike Sonko's administration setting aside 6.3 billion shillings for recurrent expenditure. In addition, 601 million shillings was approved in the Mike Sonko's budget to boost the hospital infrastructure, with Pumwani Hospital, Mama Lucy as well as Mbagathi Hospital among facilities receiving facelift. Charity Ngilu's Kitui County allocated 2.4 billion shillings to pay salaries and other services, with 506 million shillings set aside to develop the Kitui hospitals. Having recorded over 20,000 emergency services so far, Narok County has also allocated 251 million shillings to upgrade over 50 hospitals across all the sub-counties, with the Samuel Oletunai-led administration allocating 2.1 billion shillings for salaries, allowances for medical officers and other health services, translating to 23% of the annual total budget of 9.5 billion shillings. Marsabit County, on its part, has 1.1 billion shillings for salaries and other health expenses, as well as 766 million shillings for health infrastructure. Kisumu County, whose nurses are still on strike, has 2.8 billion shillings in its bank for recurrent expenditure on health, with an additional 300 million shillings for development. Nairobi Senator Johnson Sakaja says governors have been taking nurses for granted and wants the CBA honored.
Kwa mwaka moja, nasa anaosema tu ongezewe 20,000 shillings per month allowance. Yele kazi anafanya for more than 12 hours. Wengine wanafanya 24 hours. Kuna hospitali ambapo nurse ndio wanatibu, ndio wanafanya blood test, ndio wanapika chai.
Meanwhile, clinical officers will hold a crucial meeting later in the week to chart their way forward over their collapsed CBA negotiations. Stephen Letoo, Citizen TV.